So this working group is really energized, and we have a ton of ideas for how we can improve education through the FETP network, as well as sensitize our members to what is going on with climate and health in their region. So to start things off, we are going to be having a monthly webinar series where we will be bringing together experts in various fields of climate change and health, for example, heat-related illness, air quality, and we'll be learning from those experts what the health impacts are. Simultaneously, we'll be learning what FETP residents are already doing in their training to work towards understanding these types of impacts in their communities.
And each webinar will feature speakers from all over the world who are field epidemiologists, so they can share and discuss examples of climate-related health threats that really have real-life implication in their country, and also they can discuss what is being done to respond to those threats. And participants of those webinars will have a chance to hear the experience of fellow epidemiologists.
We'll also be working with individual FETP programs to build case studies that have really, local and even regional importance to help those programs strengthen their climate and health knowledge and the training that's happening there.
Well, many FETPs are hosted in national public health institutes, and ENFI really being the only organization that connects, develops, but also strengthens national public health institutes around the world. We've been reaching out to member institutes to invite them to share their experience during the upcoming webinars, or also share their experience through case studies. And also the ENFI has its own working group on health and climate change. And that working group brings together experts on climate and health from national public health institutes all over the world. And some of those experts have agreed to join TEPHINET's working group to support the integration of climate and health within the FETP curriculum. The ENFI, we're all very delighted to collaborate on that really important initiative. And we're looking forward to seeing climate and health being brought into the FETPs around the world.
Importance of having the capacity for new topics such as climate change and health overseen by a working group such as TEPHINET setup is key, because then you can depend on some materials having been developed according to the standards that FETP programs are used to achieving. They are being developed with consideration of the difficulties of bringing together the learning value that is coming from the multidisciplinarity of these complex topics. And so I can see that it's an immensely valuable resource for fellows and programs around the world to be able to refer and to depend on the work of the TEPHINET working group on climate and health.
To be aware that the working group is doing its work in the best interests of FETPs. So FETP residents, graduates, and faculty can look forward to more events related to climate change and health from TEPHINET. There will be more opportunities for FETP residents to engage with experts on climate change and health in order for them to formulate projects in order to attain their competencies, of course, projects that are related to climate change and health. And I think overall they will have a deeper understanding of the upstream factors related to climate change and public health emergencies.
I think through the knowledge that they learn, they can adapt and they can develop their own tools to intervene their own problems. The climate change and the climate variability effects on people is happening, and I think we have a space in the TEPHINET network that we can educate people and we can allow them to use this information to improve the decision-making process that they are doing in their local work.
So I think this is important because the burden of climate change related health impact is increasing, and it's a global burden, and therefore there is a need for this capacity to be distributed across the world, to be developed further.